In a briefing to Parliament's Portfolio Committee, Health yesterday, Dr. Glenda Gray mentioned that with the lifting of the alcohol ban, emergency rooms and hospital beds have begun to fill up as a result of alcohol-related injuries. She further noted that hospital beds must be kept open for COVID-19 patients. How do we balance the right of individuals to freely access alcohol during the COVID-19 pandemic with the need to free up more hospital beds and save lives for COVID-19 patients? Maurice Smithers, Director of the Southern African Alcohol Policy Alliance of South Africa, joins us now to discuss this. Maurice, good evening, and thank you for your time. To what extent is allowing people access to alcohol directly contributing to the increase in infections? And not anecdotally now, I don't know if we do have data that speaks to that.
Look, we don't have data, unfortunately, but I think that it's fair. There are two issues that have happened around the access to alcohol. One is, as Dr. Glenda Gray mentioned, the fact that hospital beds are now filling up. I think in the first week of June, in some hospitals, the number of cases, trauma cases into the hospital increased by over 100%, more than doubled, in other words. And it seems that about 50% of those could be alcohol related. So that's the one issue. The other issue is that the problem with alcohol is that it's what you call a disinhibitor. So when people are drinking, they've had 1, 2, 3 drinks, they become relaxed. And the danger there is that they then begin to ignore the COVID-19 safety regulations around wearing a mask, around social distancing, cough etiquette, and so on. So the risk of spreading the virus is therefore much greater.
Now, the political and economic commentators, Maurice, would tell you that there is economic hardship, right? That people who are struggling, there is crime when they ban alcohol. And of course, there is violence, there's looting of liquor outlets, there's illegal selling and buying of alcohol. And of course, people have a right to do what they want to do. If they want to drown themselves in alcohol, it's their right and they should be allowed to do that. What are the compelling reasons, in your view, that we should be looking at in as far as saying South Africa should go totally dry as we fight this pandemic?
Okay, first of all, let me just address one question which one of your social media people mentioned, and you mentioned now as well, this idea that people should have free access to alcohol. The fact is that alcohol is a legal drug. Like tobacco, it's a drug. The only difference between it and many other drugs is that they are legal. That doesn't mean to say that they mustn't be controlled. And that's the issue that we are talking about, is that, there's a study that was done called Alcohol, No Ordinary Commodity. It's not like any other commodity, therefore there has to be some control. So this idea that there can be free access to alcohol is just a false one. And part of the reason for that, I mean, somebody said to you just now, if someone decides to drink in an unsafe way, then it's their own problem. The problem is not their own problem, because the impact that they have when they drink in an unsafe way on society can be very damaging through, for example, drinking and driving, through interpersonal violence, through gender-based violence, through various other ways in which alcohol, the unsafe use of alcohol impacts on society. So I just wanted to get that point out of the way.
Yeah. But we know now, Maurice, that we have limited resources. We have constraints in resources. If you ask small businesses, they didn't get the relief fund. Just there's not enough money. If you ask the tourism sector, they didn't get the relief fund. If you ask artists, they didn't get the relief fund. There are employees who are battling to get the UIF. So the economic impact and the economic vulnerability is one of the biggest issues that I think government considered when they decided to lift the ban on alcohol. So you tell me, what steps can be taken to address the economically vulnerable?
Sure. Look, I think, let me say that first of all, we were very surprised when government did a ban, because that was not the common pattern around the world. There was only about 10 countries in the world that did a complete ban on alcohol. Most allowed access to off-consumption, which is the current case in South Africa in after level 3. And we're very aware that it actually has got economic implications for a lot of people. So our argument really is that a ban is really a last resort. That government has got, there are laws in place currently. There are now regulations under the state of disaster. What we are saying is, first of all, enforce those laws properly. Secondly, we think some of them should be tightened. For example, reduce the number of days that you can buy alcohol by 1 day. That means that people can still get access to alcohol, traders can still make a living, but you're reducing availability, reducing the amount that's being consumed, reducing then the pressure on the hospitals and so on. We're talking about possibly limiting purchasing amounts. Another option is maybe no off sales by on consumption outlets. You know, we have something like 90,000 licensed outlets in the country. 65,000 of those are on consumption and 25,000 off consumption. With the new regulations, the entire lot are selling off consumption. That may be a problem because there's too much alcohol available at the moment. There are other issues like reducing increasing pricing of alcohol. Part of the problem that we have is alcohol is very cheap in the country, particularly beer and particularly the larger bottles. So we're saying don't allow the sale of large bottles of alcohol, and secondly, increase the prices. In other words, we're not saying that people must stop drinking. We're saying people must drink less, because the less they drink, the less likely they are to drink in an unsafe way, the less likely they are to drive dangerously or to get violent or to behave in a way that is antisocial and can actually create problems. And through that, we can try and reduce the burden on the hospitals. I mean, you were pointing out that Gauteng is spiking at the moment. And I was reading an article the other day that said that there was at one point a belief that public hospitals were going to get overcrowded first, and then the overflow would be channeled to the private hospitals. Well, apparently the private hospitals are almost full already, and so they're going to be channeled to the public hospitals, which are already overburdened. So we have to find a balance, and that's all we are saying. We're saying we have to find a balance that is in the interest of the fight against the pandemic, but is also in the interest of the safety of the community, the safety of ordinary people, the safety of women and children in particular, who are very vulnerable to violence that happens around the use of alcohol.